Hi, I'm Dr. Ananthakrishnan from the Massachusetts General Hospital in Boston, and I'm here this year at Digestive Disease Week to present my data on vitamin D status and the risk for incident Crohn's disease and ulcerative colitis in women. Now, inflammatory bowel diseases, which comprise Crohn's disease and ulcerative colitis, are chronic inflammatory disorders of the intestine, and we have seen that over the past 50 to 60 years, there's been a tremendous increase in the incidence of these diseases. There's some understanding about the genetics and some environmental factors on how they influence the occurrence of this disease, but the vast majority of why some people get Crohn's or ulcerative colitis and others don't is still unclear. So what our group at Massachusetts General Hospital in Boston did was to look at the influence of vitamin D in influencing the risk of Crohn's disease and ulcerative colitis. Now, there is some animal data where mice who are deficient in vitamin D tend to get colitis more, and treating such mice with vitamin D helps to treat their colitis. So we asked the question, is there a similar relationship in humans? Now, there has been some data that suggests that low vitamin D may be associated with diseases like multiple sclerosis, type 1 diabetes, and asthma, which are somewhat similar in their occurrence to inflammatory bowel disease. So, to analyze data for our study, we used a large cohort of women called the Nurses' Health Study. This is a cohort of about 120,000 women who were enrolled in 1976. They were between the ages of 30 and 55 years at the time of enrollment. They filled out questionnaires with detailed diet and lifestyle exposure at the time of enrollment, and they filled these questionnaires every 2 years, updating their medical history. Two gastroenterologists then went over all the medical history to confirm who among these women developed Crohn's disease and ulcerative colitis. Previous studies from the Nurses' Health Study had come up with a model where we can predict what an individual's vitamin D status is. As you know, there are several factors that influence an individual's vitamin D status. Exposure to ultraviolet sunlight and region of residence are very important factors, but apart from this, we also have racial differences in vitamin D. We have dietary intake of vitamin D, whether you're taking any supplemental vitamin D, and also, importantly, your body mass index and your physical activity. So all these different parameters come together to influence an individual's vitamin D status. And prior research using the Nurses' Health Study had come up with a way where all these factors were put together so that we can predict what an individual's vitamin D status is. For the purpose of our study, we started our analysis in 1986, and using all the information gathered up to that point, we predicted what the vitamin D level in a woman is at that point of time. These women were then followed out till 2008, so for a period of 22 years. And we ascertained who among these women developed Crohn's disease or ulcerative colitis. And we then compared the vitamin D status in these women to women who did not develop Crohn's disease or ulcerative colitis. We found some very interesting results. Importantly, it's important to remember that the vitamin D status was ascertained before they developed this disease. So at the time of the vitamin D, these women were completely free of disease. But if you follow them out for 22 years, we found that dividing the vitamin D status into quartiles, or 4 groups, we found that compared to the group that had the highest vitamin D status, the people with the lowest vitamin D status were much more likely to develop Crohn's disease or ulcerative colitis, even adjusting for other known environmental factors like smoking. If you assume the risk of Crohn's disease or ulcerative colitis to be 1 in the women with the lowest vitamin D status, women in the highest vitamin D status had a risk of about 0.5. So they experienced nearly a 40 to 50% reduction in their risk of Crohn's disease. This was seen right up to 2008. We then looked at specific factors that influence vitamin D status, and we looked to see if diet or supplemental vitamin D was important. And we saw a similar trend where women who had higher dietary or supplemental vitamin D intake had a slightly lower risk of developing Crohn's disease, but this was not as prominent as when we examined vitamin D status as a whole. So that leads us to believe that dietary and supplemental vitamin D intake and the standard doses is an important factor, but it does not appear to be the key factor determining why some women with low vitamin D develop Crohn's and ulcerative colitis and others don't. If you look at ulcerative colitis, we see that there's a similar reduction. Women with the highest quartile of vitamin D status, so the best levels of vitamin D, had a slightly lower risk of developing ulcerative colitis, This risk reduction was not as prominent as we saw for Crohn's disease, but was still borderline statistical significance, what we would call a statistical trend. Again, if you look at dietary vitamin status for ulcerative colitis, we saw a similar reduction. The more vitamin D or supplemental vitamin D you're taking in your diet, you're at a slightly lower risk of developing ulcerative colitis. But again, this diet and supplemental vitamin D is not the key factor that's determining the difference, but the individual's overall vitamin D status seems to be important. So the take-home message from our study is that a higher vitamin D status, even prior to diagnosis, seems to reduce your risk of Crohn's disease by about 40 to 50%. There's a similar reduction in risk for ulcerative colitis, though of a slightly lower magnitude. Dietary and supplemental vitamin D status at the standard doses does seem to influence this risk a little, but it's not the dominant influencing factor, which suggests that overall other factors, including physical activity, region of residence, body mass index, and diet, all the factors that influence a vitamin D status need to be taken together in modulating the risk of Crohn's disease or ulcerative colitis. I think our findings raise some key questions that need to be answered in the future. So one question is, why is there this difference between Crohn's disease and ulcerative colitis? But a second more important question is, how do we use this information to either prevent Crohn's disease or ulcerative colitis? There's some preliminary data that people with low vitamin D and Crohn's and ulcerative colitis may have more active disease. So that raises the question of whether vitamin D can be used to treat active disease as well. So these are studies that we are currently developing. We're also trying to understand how vitamin D status and genetics influences your risk of developing Crohn's disease and ulcerative colitis. And I think in the next few years, you're going to see a tremendous amount of new information on vitamin D status and its role in Crohn's disease, ulcerative colitis, and you're going to see potentially new trials where vitamin D is used to prevent or treat Crohn's disease or ulcerative colitis. Again, this is very preliminary research that suggests in humans there may be a link similar to that's been seen for other diseases and in animals, and there's much more research that needs to be done in this area, but it seems promising. Thank you.